Skin cancer is an uncontrolled growth of one of the major cells of the skin. So you have the three main types we talk about are melanoma, basal cell, and squamous cell. Basal cell skin cancer is the most common, but fortunately the least serious type. It's actually more common if you take lung, colon, and breast cancer and add them all together. But the melanoma is the one that can be the most serious and can affect people actually at quite a young age. Skin cancer can have some different signs and symptoms. Two things I tell people to watch for. One is an ugly duckling, or a spot that is just different than all of your other spots. Especially like melanoma would be a dark, funny looking mole, asymmetric. We'll often talk about the A, B, C, D, E's of melanoma. Asymmetry, border, color, diameter, or evolving. The other thing to look for are non-healing sores, so like a pimple that won't go away, a scabby, crusty lesion that just won't heal, bleeds for no reason, those kind of things. There's many different treatments available for skin cancers. The important thing is just detection, to getting them looked at, because if just like any cancer, if you catch it early, it's very treatable, versus those things that get missed or ignored, that's where they become really problematic. So first thing is getting it looked at by a professional to see if it is something serious, or a lot of times we see people in and it's just a completely benign lesion and we can give them peace of mind and we don't have to do any kind of treatment. But the first treatment usually for a suspicious lesion is to remove it with a small biopsy, and then we examine it under the microscope, and if it is actually skin cancer, then we would move on and actually probably do an excision. The nice thing is most of those can be done right here in the office. We don't have to go to the operating room. We're not putting anyone under. You can drive yourself to and from your appointment. It's just a very simple in-office procedure. If someone has skin cancer or pre-cancers, we'll sometimes see people for as well, or unusual moles, we usually would say at least yearly. It varies a little bit based on the exact diagnosis. For example, melanoma that's more serious, we might want to see people a bit more often, maybe every 3 months or 6 months. But if it's something that's a little bit less serious and early, say basal cell or squamous cell skin cancer, that may be just as infrequently as once a year.